Pudendal neuralgia, the nerve condition that gets missed for years. Pain or burning in the perineum, the genitals, the rectum or the inner thighs that gets worse when you sit down and better when you stand or lie. If that sounds familiar, there's a good chance you've been told by multiple conditions that nothing is wrong, because pudendal neuralgia is one of the most consistently missed conditions in men's health. In this episode, I'm going to explain what it is, what gets missed, and what actually helps. I'm Steve Carter from Male Health Clinic here in Beeston, Nottingham. Pudendal neuralgia is something I see in clinic, and it's a condition that deserves proper clinical attention rather than dismissal. Pudendal nerve is the main nerve supplying sensation to the perineum, genitals, and anal area. When the nerve becomes irritated, compressed, or inflamed, the result is pudendal neuralgia. This is a hallmark symptom where is pain that is worsened by sitting and relieved by standing or lying down. It can feel like burning, stabbing, aching, or numbness, and in men it often presents as pain in the perineum, the scrotum, the tip of the penis, or the glans. And also you may get a little bit of desensitization or numbness. It can also cause urinary symptoms, bowel changes, and sexual dysfunction, which is one of the reasons it's so often investigated through the wrong pathway. Pudendal neuralgia is missed for several reasons. Standard investigations, urine tests, MRI, ultrasound typically come back normal because the issue is nerve irritation rather than structural abnormality. The symptoms overlap with conditions such as prostatitis, pelvic floor dysfunction, and intestinal cysts. Without a clinical specifically looked for pudendal nerve involvement, it's easy to miss. Many men spend years cycling through investigations before somebody puts the pieces together. Proper treatment starts with a thorough assessment that specifically evaluates the pudendal nerve and the structures around it. Management typically involves pelvic floor rehabilitation, addressing any muscle tension or imbalance contributing to the nerve compression, alongside targeted nerve treatment where indicated. Lifestyle modifications also matter, reducing prolonged sitting, addressing posture, and managing any contributing factors specific to that man's situation. Progress with pudendal neuralgia can be slower than some other conditions, but with right assessment and a structured approach, meaningful improvement is achieved for many men. If you've been living with these symptoms and been told repeatedly that there's nothing wrong, please know that there are clinicians who take this seriously and know what to look for. Subscribe below for more content on men's health. Or for a free informal chat, click the link in the description where if you'd like to discuss your own situation or symptoms.